All right, so what are anatomy and physiology? So what does class mean? So anatomy is the study of body structures. So basically the form of your body, all the structures within. And then physiology, this is a study of the body's processes and functions. So it's not only just like what the parts of your body are, but also how they function together. Now with anatomy and physiology, so here we have a bunch of car parts, and a good mechanic can name all these parts, how they fit together. They know where the location of all these parts of an engine are. But just by knowing the parts of the engine, do you know how an engine works? So you can name and recognize all these parts, but a good mechanic not only knows the names of all the parts and how they fit together, but also how they work together. So anatomy is like knowing all the parts of your body and how they fit together, where they're located. And physiology is knowing how they work together. So again, a good mechanic will know like how to fix a car, because they know what parts there are, what their function is, how they fit in the overall car. And then if they're trying to repair the car or the engine, they know which parts to replace and look at, test, and then how to fix it as well. So just like healthcare professionals, they not only need to know the parts of the human body, but they also need to know how they're supposed to function as well. Because if someone's suffering from a disease or some sort of disability, then they want to try to help fix that problem as well. So a good mechanic just doesn't know anatomy, it also knows physiology. Okay, for the slides, they'll be uncensored, but you're going to see a lot of the human body because again, it's anatomy, right? So there is nudity in anatomy and physiology. Of course, it's all in very clinical settings. Actually, this is left over from Twitch because Twitch has stronger, I think, nudity policies than YouTube Live. So YouTube Live is pretty relaxed, but the thing is like sometimes these get age restricted because they say like, okay, it's showing naked bodies, so then we have to restrict it. So if you see these blurs, that's just because it was like left over from when I streamed on Twitch. All right, so think about it this way. Okay, looks like most of you said left, and the most of you are correct. This is the left side of the body. So the thing about the left side of the body, so why you might be like, wait, isn't this the right side of the picture? So in medicine, it's not about you. It's all about the patient. So this is the left side. This is the patient's left, because if you're telling the doctor, my left arm hurts, and they say, well, from my perspective, that's my right. Therefore, I think this arm hurts. So again, it's about the patient describing where their pain is, and this is what you should use for anatomy. You're talking about the patient's left, not your left. So I think people who have experience in theater, they say like, is it audience left or stage left? So I believe it's like talking about stage left versus like actual like the audience. You're just a doctor. You're not a doctor or healthcare provider. So again, it's about the patient's left and right, not your left and right. So I don't have this mixed up. This is the left side of the body. So because again, you have to kind of think about it like, this is the person you're coming in to see you. This is their body, right? Okay, so this is the right side of the body, so, correspondingly. So everyone knows left and right. And once in some older textbooks, you might see sinistral and dextral, but that's kind of largely out of favor. This is one time where they actually do use the common terms for left and right. All right, new poll. So who among these people is most likely to be single? Okay, so it looks like in terms of the poll, 8% said A, 16% says B, 31% says C, 46% says D. But if we're talking about the flower, the person most likely to be single is this person right here. And why is that? Well, notice where the flower is on all of these people. So this person is hard to tell. So she's wearing her flower on the left side. He's wearing the flower on the left side. She's wearing her flower on the right side. And he just has a hakule. He doesn't have a flower on either side. He has flowers all up and everywhere. But, so this is what I heard, and this is what I heard growing up. But if you put the flower on your left side and your left ear, that means you're taken. And why is that? So again, pua on the left is kind of like when you wear your ring on the left hand, right? So that means your heart is taken. And your heart actually, so they think it's like, okay, it's the one if it's on the left because the flower is closer to your heart, that means you're taken. So if it's toward your left. If it's on the right, that means your heart isn't taken and that you're single. So kind of like wearing your ring on your left versus your right. So yeah, if you're just going by the flower, this is a way you can signal you're single or not. Although some people, they don't know this rule and they're like, oh, okay, then why are you hitting on me? I'm taken, but they just don't know this. I mean, I don't know, it could be different on other islands. I mean, I grew up on the west side of the islands or a different side, but this is the way I learned it. Okay, and why is it important to know left and right? Because you want to treat the right side. And even when you're into medical school, and this is the scary part, like surgery mix-ups, and this was back in 2010, and I'm pretty sure if I searched now, like, I mean, granted, I can't search right now because you don't want to be in an emergency room right now, okay? Because like it's like when you have wards completely and all beds filled with COVID patients, but that's another thing to say for another day. But again, this is what can happen if you don't know the left or right. Say someone has a right kidney that's failing, and then you don't you mix it up and you accidentally remove the left kidney. Well, if you remove the healthy kidney, you left the diseased kidney in your patient, and now they need a kidney transplant, and now they're suffering from renal failure. So again, it's very important to know the left and right. And yeah, so amputating the wrong leg. Say you have to amputate infection in your right leg, and then you accidentally amputate the healthy left leg. You left them with a diseased leg, and you have to cut it off anyway. And so now they're without both legs. So this is why it's very important to know left and right. And I love showing this because this guy right here, he needed to amputate his left leg or left lower leg right here. He actually got this tattoo to make sure that there's no issue. And this is why it's very important in surgery that surgeons actually label this and make sure that where the injury is, if it's on the left or right side, because again, you don't want to cut off healthy tissue. And I think there was actually an interesting regeneration question in Pack Back. But yeah, you don't want to, this is why it's important. It's very elementary, but if you mix up left and right, that can cripple your patient, or it could potentially kill them as well. So again, I love that tattoo.